Yes, so nice to meet you. How are you finding the conference so far?
Awesome.
Awesome, yeah? That's really good. So what do you do?
Oh, well, my role is very broad.
Okay.
I specialize in breast advanced practice. So I do literally everything breast, film reading, biopsies, clinical breast examination, name it. I do a bit of leadership and management, and I do a bit of research as well.
Research,
So many things I do.
Okay, so you're a mammographer in essence. With all of this advanced practice. So you're in the consulting arena. Yeah. Okay, and how long have you been in these positions as a mammographer? How long have you been there?
I've almost lost the plot. 2007 till date is what?
About 17 years.
About 17 years then. That's what I've been in breast.
Okay, so that's really good. And have all 17 years been in the UK?
Yeah. I trained in the UK. My initial training, my master's, everything was in the UK. But I was a radiographer from Nigeria.
Okay, so radiographer from Nigeria, but you did your mammography specialization and training and advancement here in the UK.
Yes.
Oh, that's very nice. Yes. That's very nice. Okay, so I'll just ask you a couple of questions.
Okay.
So in your experience, you may not have had an interview recently. However, in your experience, what is the toughest interview question that you've ever been asked as a mammographer?
Oh, well. One or two were tough, but it's been a long time. I think the table has kind of turned for me. I am the one asking these questions to people. So, but I think one question that was hard for me was, what's your weakness? Whenever they ask that question, I'm like, wow, how can I be the one saying my weakness? Although you know yourself, but your weakness might be like shooting yourself in the foot for the interview, isn't it? So what I learned over the years is that when they ask you what your weakness is, you've got to get really smart. You've got to get really smart how you play that question, because you're going to say what your weakness is, but you're going to stir the sheep and make it have a positive outcome. For example, when I'm asked this question, I usually I start by saying, it's difficult to say what my weakness is, because it's more of my colleagues who like see my kind of weak points, isn't it? But the much from the feedbacks or from knowing myself, what I think is that I tend to say yes to everything. So I don't know how to be assertive, because I'm just a natural carer. So when people ask for help, I'm always helping and giving. So, and after some time, I realized it causes a little bit of burnout. And what I then did was begin to assess what I can do and what I can't do, and trying to make sure I'm not taking on too much. So I think I've made some progress with this weakness. So this kind of how I play that interview question, because even though you're saying you have this as a weakness, you're going to end in a strong point that you've actually done something about this weakness.
Yes, okay. That's really good, because you're putting, like you said, a positive spin on it, so that it does not dent your image overall in the interview process. Yeah,
exactly.
Okay, that's very nice. Thank you very much. And if you were interviewing a new mammographer, so you're on the interview panel, I'm sure that's what you do in your day-to-day life. So if you were interviewing a new mammographer, what is one question that you would definitely ask them?
The thing is this, you ask a mixture of questions. You ask questions that are technical or background to know their kind of training and stuff. But really, I'll just spill the beans here. That's not what you're looking for. You're not looking for the skilled mammographer or anything. The truth is that most people interviewing are looking for the personality. And the personality comes across the way you answer the question, the way your body gesture comes across, the body language, and the way you go about answering that question is already giving us a glimpse into your personality more than what you say you can do, because most people are not really interested in what you can do, although some people might be looking for someone that will hit the floor running. but that's not really what they are looking for. Every manager is looking to employ someone that is not going to give them headache. So they're looking for someone that will like play the team, play in the team the right way, and be a blessing rather than a problem to the team. That's really what they're doing. And that's really why people do face-to-face interview. They want to know exactly. So really, they just ask you random questions, just a little bit of career, but more broader questions like your likes and dislikes, your weaknesses. Those things are really to glean a bit about your personality. Or they ask you things like, what have you done in your career pathway? Tell us a bit more about your career up until this point. They're just trying to find out, or they start giving you scenario questions, but they're trying to find out what your personality is like, not really the skills, because most times they are willing to train you, or policies and the way people do things change from trust to trust. So they're not really looking. So that's the thing. So I think interview is a little bit of a mask, because the questions that are asked is a little bit of a mask. It's more of what the person is bringing to the table, especially in their personality rather than anything else.
Yeah, so it's really very important that you're able to demonstrate you're a good team player.
Yes.
Because even though you have the skill, if you're a terrible team player, it's still not an addition to the team, is it? Okay, that makes a lot of sense. So thank you for that. Okay, and then which interview question do you think that every mammography applicant should definitely prepare for? What's one question you feel they must prepare for?
I think one they should prepare for is trying to say exactly where they want to be in the next 5 years.
Okay.
I think that's a good one to prepare for, because it helps them know, are you the ambitious one, or are you just happy to be basic? And then they kind of know where you're going, and if you're willing to stay with them or not, you know?
Yeah, so that's a good one. And then what is one piece of advice that you would give to someone who is preparing for their mammography interview?
It varies really. It has a lot to do with their skill set. Are they already trained? Are they not trained? So that will depend on what they will prepare for. If they are coming for a trainee role, what is expected is different from if they are coming for a qualified role.
Yeah.
You understand? Yeah. So that it depends on what the job description is saying. So what I will definitely encourage them to do is check out what they are looking for by looking at the job description and the person specification, really, to tell you exactly what they are trying to recruit. Then kind of align yourself to that. See if you match that skill, or if that's what you're looking for yourself. Because, you know, this recruitment and interviews is a two-way thing. Yeah. You know, for example, many people, it took me a while to realize this, that many people don't realize that it's always a good idea to have a question to ask the interview panel. Because when you don't have a question for the interview panel, it portrays a different personality, lack of confidence, a bit docile, not really willing to, you understand? So, but when you have questions, even if it's just to say, oh, would you be willing to support me with my childcare arrangement, or with some relocation, sponsoring my visa, or will you be open to training? You understand? Will you be open to things like that? Things not over ambitious, but things you think might impact you and make you happy.
Yeah.
So it's always a good idea to just be upfront with them and ask. And then, especially depending on, I think when you're interviewing, you are having a feel of the personality of the management.
Yeah.
And the management is having a feel of your personality. Because in my career pathway, I've walked into an interview and the atmosphere, I didn't want to work for the trust.
Okay. Yeah. So it's almost like the applicant is interviewing the employers as much as the employers are interviewing the applicant.
Exactly. Because I know it's desperate times and many people look for jobs. But even though it's desperate times, you've still got worth and you're not rubbish. So you've got to always remember that you've got to know, not to stay humble, but also that you know where you want to go. So you don't want to put yourself in a position where you can't work. Maybe you can feel it that they didn't like you in the interview, or you can feel the atmosphere. You might not, it might be like you are getting a kind of, what's the word now? A red flag.
Yeah.
Do you see?
Yeah.
So that's it.
So it's good to look out for that as well.
Yeah. And that's where that's where what I said earlier comes in, because you need to actually say, have your questions ready, that when they finish asking you questions, you've got to be willing to also ask them questions.
Yeah.
You're not going to drill them, but always try and have at least one or two questions you're going to ask them.
Yeah.
It makes it a whole lot of difference.
Thank you so much.